over a year now. I'm at a private practice that is located at St. Mark's Hospital. So I'm also credentialed and able to see patients as a consult at the hospital as well, which is really fun. And I'm here to talk to you guys about skin cancer. It's such a passion of mine. It's important. Chances are that many of you in this room have been touched by this personally in your families or maybe in your own lives. We'll definitely open up to questions that you have. I won't be looking at any of these spots today, but happy to answer any questions in general that you have. I'm just kidding. I would be happy to if necessary. I do it on planes, trains, and automobiles all the time. Okay, so first of all, we need to establish why this matters. And you probably already know that because you're here to learn about it and hear about it in general. But skin cancer is the most common cancer in this country. It's, you know, maybe one that you'd want to have if you're going to get a cancer, but, you know, that's arguable depending on what type it is. 1 in 5 Americans will develop skin cancer by the age of 70. So that's super common. 20% of people in this room will develop it by the time they're 70, if you haven't already. The good news is that it's highly preventable and highly treatable once we find it in its early stages. That's what I love about my job, is that there's things that we can do about the skin cancers that I find. Utah consistently has one of the highest incidences of the bad one, of melanoma. So that's definitely job security for me, but it's also, it makes me passionate about finding these things when they're really small and really early. So getting anybody in for a skin check is so important at a baseline. And then we kind of talk about what might lead you to come in, you know, on a regular basis, but everybody should have a skin check sometime in their life early on. And this is, you know, a prime example of why Utah has such high rates of melanoma, right? So it's high elevation. One of my MAs kind of compares it to like we're kissing the sun, like we're just like so high up and closer to the UV rays. And it's an outdoor enthusiastic population. So a lot of people spending time outside, and the sun's always out. So I moved here from the East Coast mostly because of how many sunny days are here. You know, I was lucky enough to find a job here, and I'm happy to be working here, but I'm also an outdoor enthusiast who spends a lot of time outside, and it doesn't stop me from enjoying the outdoors. I just have to do it with some safety precautions in place. No one likes to take me to the beach, that's for sure. So kind of establishing who I am a board certified dermatologist, meaning I went to medical school, I went to a dermatology residency, and now I'm board certified by their kind of powers that be. I'm experienced in medical and cosmetic dermatology. I do lean more into medical than cosmetics because there's plenty of that to go around for sure. And I'm very passionate about education and prevention of these things because I think it makes a huge difference rather than taking care of it once it's too late. So the 3 main types of skin cancer is basal cell, squamous cell, and then melanoma. These are pretty typical examples of them. They're kind of zoomed in and pixelated, so we'll go over some other examples, but you're not exactly expected to find these. I am, but you should know kind of in general what they look like. Basal cell carcinoma is the most common type of skin cancer that we find. It's related more to intermittent, intense sun exposure. So if you had a lot of burns as a young person or throughout your life, that's more of a red flag than, you know, cumulative sun damage. So that plays a role as well. Risk factors other than that include having a light skin color, having red or blonde hair, childhood freckling, being immunosuppressed in some way, as well as having radiation to the area or arsenic exposure, if you're aware of that in your life. So this, I hope this translates well. That there, the word is escaping me, but they're all not always super obvious. So I don't know if any of you can spot the one here. Yeah, you probably were drawn to like one of these dark spots here or something like that. That's right here. So zooming in a little bit, I know it's funny. I know. So there it is. This is kind of the comparison of zoomed out versus zoomed in version. I know, my job's not easy. Sometimes, in addition to these pearly spots, they can look kind of like eczema. They look like a pink scaly spot that does not go away. This is the type that comes up that's really superficial, really early, easy to treat. And this comes up on the trunk, arms, and legs. This is a pretty typical example of what that looks like. Basal cell carcinomas, their treatment varies as far as where they're found on the body. Mohs surgery, maybe some of you in the room have heard about. It's a specific type of skin cancer surgery. It's the gold standard for ones that are found in the head, neck, and other sites. Sorry, I should have warned you before I showed you a hole in somebody's face. Anyway, this is the typical defect after a pretty large Mohs surgery, but they have great outcomes. They have training in plastic surgery, as well as dermatology, as well as pathology. So they make sure you're clear, and then they do a repair. And this man had a what's called a bilobe flap. So it's kind of, here's the scar line from it, but pretty subtle, turned out pretty great. But we don't like it to get this big before we remove it. Other methods for removal on the body include just a simple excision. You don't always have to have Mohs surgery, or we could do local destructive means, including like scraping it off, burning it off, combination of the two, or radiation. But radiation is kind of, for me, this infant stages of being perfect. So, okay, so that's all for basal cell. That's one big bucket category of skin cancer. The next one we'll talk about is squamous cell carcinoma. This is 1/5 of all skin cancer, so it's a little bit less common than basal cell, but to me, it's kind of in the not melanoma category of skin cancer. It's also related to UV exposure for the most part, though other risk factors exist, including, again, the radiation. There's a small population of people who had acne treated with ongoing UV radiation treatments, and we see a ton of skin cancers in those people. So they're a big group of people that we've had in that. Though there's other types of UV treatment that you can have that's safe. What we used to do is essentially like x-rays over and over again. It's just not good. Other places where squamous cell carcinoma can show up is in areas of chronic inflammation. So if you had like a really bad burn on your leg from a motorcycle wreck, or if you have a chronic blistering disease, or you have a blistering issue that's ongoing and ongoing, you can have this squamous cell carcinoma develop there. In women, you can have vulvar issues like lichen sclerosis or other diseases like that. That's also ongoing inflammation, and we take those pretty seriously and monitor those closely, because you can get a squamous cell carcinoma that can develop there too. Arsenic exposure and also viruses such as HPV can play a role with this. Squamous cell carcinoma, generally, it's a not melanoma skin cancer, so it's in the good category of skin cancer still for me, but some areas can have quite high mortality rates, especially on mucosal areas like lips, genitals, and perianal. But I'd kind of put head and neck advanced squamous cell carcinomas in this category as well. This would be that one. Sorry, I should have warned you again. Question? So the question in the room is, how do you get a squamous cell carcinoma in these mucosal areas that aren't on the lips, that obviously aren't sun-related? Probably. They are almost always related to HPV, human papillomavirus, which thankfully most young people are getting vaccinated with Gardasil or other brands of that. So I'm hoping to continue to see a decrease in the diagnosis of that along with cervical cancer. But only time will tell. Genetics play a role as well, but for the most part, it's exposures for that. So squamous cell carcinoma does usually develop from a precursor lesion. If we're talking a sun-related type of skin cancer on sun-exposed areas. Bonus points for anyone who knows the precursor lesion. No, it's called an actinic keratosis. You'd really only know it if you ever came to see me and I overeducated you. But so you can get actinic keratosis on your face. There are these kind of pink gritty spots that just don't go away, and sun exposed spots. And sometimes, you know, your immune system can take care of them on its own. I don't often aggressively treat them in young people for that reason, but they can, over a period of 10 years or so, 10% of them might turn into a skin cancer. So that it's slow and it's gradual, so it's not overnight. But the good news is that there's a precursor lesion. So squamous cell carcinoma can be reddish, pink, or skin colored. They often have crust or erosion or ulceration, as this one did on the person's helix of their ear, and then this is on an extremity here too. So these are just non-healing wounds. That's kind of my main takeaway today. If you have something that's not healing, it can not necessarily for sure, but it can be a risk. Okay, so that's the second bucket. The first one was basal cell carcinoma. That's the one you want to get if you have to. Squamous cell carcinoma has some other unique exposure that can lead to it, and some little bit increased mortality depending on where it is, but totally treatable. Melanoma is the other category. This is the one that keeps me up at night. And I've been surprised at how many melanomas I've diagnosed here. I used to work in a rural area in Pennsylvania that I had a ton of really, really sun-damaged farmers. That's a pretty big population they saw. And I thought I saw a lot of melanomas there. I think I've diagnosed 2 every month since I've been here, which I think is a lot. But most of them have been early, which is good. Okay, so thinking about melanoma facts, 97,000 are diagnosed each year in the US. It's a lot, right? Yeah, it's a good shock face. Yeah, that's a lot, I think. She does too. If you've had 5 or more sunburns in your life, this doubles your risk, at least doubles your risk. So probably everyone in this room has had a couple of sunburns, but you know, 5 plus, I think I'd maybe put myself in that category in my previous life. So yes, something to be aware of. Tanning bed use is a huge thing. Boy, I wish these things would just all close up and go away. Some of the tanning bed places have kind of pivoted into like red light therapy and other things, which I would love to just give them a high five for, but the tanning beds have got to go. They've just got to go. Don't do it. If you do it now, today's your last day. Because it increases your risk of melanoma by 75%. And I think that's kind of a low figure, to be honest. Melanoma is the #1 cancer in young adults. So that would be 25 to 29-year-olds, but it's high up in the next kind of category as well. And melanoma is responsible for 3/4 of skin cancer related deaths. So that's the one you don't want to get, is melanoma. It keeps me up at night. Nearly 20 Americans every day die from melanoma. Have I convinced you yet that this matters? Great. But the good news is, it's not all doom and gloom. When it's detected early, which it has been, you know, in the recent past, we've been better at detecting it early and finding these spots when they're really thin and not invasive. The 5-year survival of melanoma is 99%, meaning if you're diagnosed with a melanoma today, the chances that you're alive in 5 years is 99%, which is great. Not a lot of cancers have that 5-year survival rate. Risk factors for melanoma obviously include UV exposure, but it's not always going to come up in a sun-exposed area because of these other things. Fair skin, light eyes, and light hair can play a role. A family or personal history obviously can play a role too. If you've already had one melanoma, you've shown to have the risk factors that lead you to get another one. We follow those patients a lot more closely, as well as a family history can sometimes play a role. Not always, but sometimes. If you have lots of moles, that increases your risk by a certain amount, depending on what kind of moles you have. And if you have atypical moles, meaning they have kind of different shapes, sizes, you wouldn't know that, but I can tell you that also increases your risk of melanoma. Weakened immune system, so being immunosuppressed in some way can play a role with this too. Your body's first defense against cancer of any kind is your own immune system. So kind of beefing that up with whatever you can, with diet, exercise, any other things that you read about that could help are always a good thing. But having outdoor hobbies and jobs can definitely play a role with this too. And I've seen that here in this area. The ABCDEs of melanoma is something I try to educate patients on, and you'll get that today too. This is something that you want to use if you're trying to decide if a spot is dangerous or not, or worth a close look or not. A stands for asymmetry, B is for borders, and I'll show you some examples of these. C is for color, D is for diameter, and then E is evolving, or any other changes it has. So looking first, this line here, these are benign lesions. This line here, these are all melanomas. Looking first at A, so this side of the mole is generally the same as this side. Not perfect, but generally the same. This side is, obviously it's asymmetric. The borders of this spot are pretty regular, and using dermoscopy, or this specific tool that I live by, can help me with this too. So you don't have to become an expert on this today, but the uneven borders of this one kind of play a role. Color, so this has one color, it's a reddish brown mole. This one has kind of this dark brown, this light brown, still this reddish brown. It's obviously changed in many other ways that are on this chart too. Diameter, so in general, if a spot is less than 6 millimeters, if you don't speak metric system fluently, that's about the size of the head of a pencil eraser. If it's bigger than that, it increases the risk in the mole a bit. But we'll talk about kind of the general concept that I use to help your fears with that. And then, evolving. So if this is the same mole as this is coming off that day. So the general concept I want you to think about, and what I live by when I look at skin, is finding the ugly duckling. So I truly kind of look at people's moles in general, and I try to establish what their pattern looks like, because everybody has a signature mole. Like I have an Audrey, machine that pumps out moles on my body, and they should all pretty much look the same. In general, the same size, shape, color, though there can be variation, especially if you have dysplastic nevus syndrome or other atypical moles in your family. But when I find one that looks darker, or it's bigger, or it has kind of a different pigment pattern, when I look at it closely, I'll often biopsy the ugly duckling and often find something concerning if I do. That's what you're looking for when you look at your own skin. So the big picture, the important thing to take home today is not doom and gloom, and it's just prevention. It's what can we do now? What's our action plan moving forward? So I believe that sunscreen is safe. I believe that you should wear it. I do. It's getting bad press lately, which worries me. But these things kind of wax and wane with time. I can't tell you how many times a day I hear, well, I used to use baby oil and iodine. I know there was a time that was the case. And maybe we're entering into a time where people use beef tallow instead. But I would not recommend that. Please just use sunscreen. There's different types of it. Mineral sunscreen is the kind that has kind of a white sheen left over. It's nobody's favorite type to use, but if you're not able to reapply every 2 hours, then you need to use mineral sunscreen. Because as long as mineral sunscreen is sitting on top of your skin, it's reflecting and blocking the sun's rays from reaching your skin. Chemical sunscreen is truly deactivated by the sun. So you put it on and you have to reapply it, not because you're swimming, not because you're wiping it off, but because it's not there anymore, because it's being used up by the sun's rays. So that's why you have to reapply. If you don't like sunscreen, then you have to find something else. So wearing hats, sunglasses, UPF clothing. I love that rash guards have become more common with kids. My poor daughter has to wear long sleeves when she goes to the beach because you collect a lot of sun damage when you're a young person. So trying to negate her risk as much as I can. Please, please, please avoid sun tanning beds. Seek shade, so the highest UVB rays or UV burning rays are from 10 to 4. I still go outside during those hours though, but if you can choose when your hike is or when your bike ride is or whatever, do it later or earlier than that. And checking the UV index can be informative. It's always high here. Just to give you a hint. This is a friend of mine. So if you think this is like a joke or like some movie thing, no, this is literally how young people put spray sunscreen on. This is real life. So you don't know who this is, so it doesn't matter that he did give me permission to use this in the lecture, but this is what happens generally when you use spray sunscreen. Just use cream instead. It has much better application and there's no risk of it blowing off into the wind and you won't look like a checkerboard. So just use cream. A shot glass amount, so 1 ounce, should be what you're using for your whole body. And I think that's a lower estimate too, but some people are like, wow, that's a lot, but no, that's the appropriate amount to use for your whole body. Don't forget your ears. It's a hugely important area and easily missed. Your scalp, if you always part your hair in the same way, you should think about sunscreen there. I do think that's where spray can be helpful. They also have powder that you can put in. That's nice for ladies because it's sort of like dry shampoo, but also that you can put on. That's mineral sunscreen. And then don't forget lips too. And they have mineral sunscreen versions of this that I prefer because they don't have that bad taste. So you can look for that. And it's safe for all ages, over 6 months. So before 6 months, they just shouldn't be in the sun. But after 6 months, the FDA has deemed sunscreen safe. Question? Probably not. Yeah, the question in the room was, you know, moisturizers have sunscreen, cosmetics have sunscreen, and that's one of the myths I'm going to bust later. But you know, the multi-use, multi-purpose is better than nothing for sure. But you can't depend on it if you're going out on a walk over lunch, or you know, if you're going on a hike after work, or whatever. If you ride your bike to work, you have to like use sunscreen specifically. Another question? Mhm. That's a pretty good indicator that you're using enough if you're in like regular beach wear. So a 1 ounce shot glass probably would be enough to cover me if at the beach, but I'm probably in long sleeves if I am. So no, no. For exposed areas, you would use less. Yeah, enough to cover the area, a little more than you want to. Anything else while we're talking about sunscreen? Yes, yes. Mm-hmm. Mm-hmm. So the question is, I have a young daughter, I do, it's true. And she's asking if she's out swimming and they come out and like, when do you reapply? How soon do you torture them again with the sunscreen? I lean into sun protective clothing for that reason and hats. But on the areas where I do have to reapply is usually like her legs because she's in like a normal bathing suit, but then she has long sleeves on and face. I really lean into the mineral sunscreen for her. So if I can still see it on her skin, I'm not going to torture her yet. Because you can see it like it like beads up water and it has like a white sheen. it's kind of awful, but it's really good protection. For beach and lake times, that's what I lean into. But in general, otherwise, if it's older kids that aren't going to let you put that pasty white stuff on, when they come out, towel dry off, they're not, visibly wet anymore. They got to get sunscreen on again. And if that's a time where you have to use spray, then do it. If all your husband is going to use a spray, then do it because any sunscreen is better than no sunscreen. And I personally do reapply with spray on my feet too at the beach because I'm not going to like exfoliate the sand into my feet. I just use spray then too. So there's a rule for it. Hopefully you're using a reef safe mineral sunscreen. Yeah, that's important too. That means that the particles aren't so small that they're damaging a reef. I think so small, maybe so large. I'll have to get back to you on that. Yeah. Technically 15 minutes. So the guy that like sprays and then like jumps in the pool. Ah. Is that your question too? Mm-hmm. I believe so. I know that there's a lot of press about Korean sunscreen and Australian sunscreen. I don't think that any other countries are withholding ingredients that we don't have. In general, it's the same concept if it's chemical sunscreen or mineral sunscreen. But truly, all I want you to do is find one that you like, that feels good on your skin, that you're willing to use. So if you have to get, another country's sunscreen to do it, great. I can give you some specific ones that I like here, but you have to find what works well for your skin. Hmm?
Recent story about an oncologist in rural
Mm-hmm.
for them to give medical advice to their patient.
Mm-hmm.
In one instance, they mentioned suggest that people wear sunscreen, but people responded, no, the sunscreen is actually what's causing
Mm-hmm.
cancer.
What would I say to that?
Have a response to that?
I have heard that before. And I think that there are imperfections in the medical profession. We've been wrong about things before. They keep looking at the safety of chemical sunscreens. That's really the category that people are most suspicious of. And if people want to avoid those because they're worried that they've been causing sunscreen, I kind of lean into mineral sunscreen for them because it's just a physical blocker on the skin. My response to that is that I see cumulative sun damage making sun-related skin cancers. I see it happening in my job. Those people are also people who have used sunscreen or tried to at least to negate their risk, but it's tough. It's tough. But I do admit that as doctors, we're not perfect and we may be wrong about some parts of this in the future, but all I can tell you is what I do and what I think is safe and what I've seen work too for people. Like I know that when I see someone who's 80 who has used sunscreen and other sun protective measures such as avoidance, I can tell on their skin that they don't have as much solar elastosis and changes related to the sun, and they haven't been getting so many skin cancers. You can really halt your damage by getting a sun-related skin cancer earlier in life because it kind of changes your behavior. It's tough though. Good question. Okay, so these are some of my favorites. This is one that I think rubs in pretty well for young patients or active people who like to use mineral sunscreen and not like have it with them on a long bike ride or a golf course or something like that. It still leaves a little bit of a white sheen, but I find that it's pretty user friendly. There's others though. This is one that I love for my face. We sell this at our office, but we don't really make any profit on it because retail isn't where it is. But I like it so much that I have started selling in our office because it just feels so nice on your skin. It has kind of a matte finish and it's nicely tinted. I think there's other versions of this brand though that aren't tinted that are nice as well. Yep. Yeah. It's just marketed that way because many people think that mineral sunscreen is better for kids than chemical sunscreen, but my daughter gets both. And then this is a tried and true for me. I think that the sweet spot is with 45 with this one because the 30 I don't think is quite as protective, and the 70 for me isn't one that I'm willing to use on large areas. So this is something that I use when I'm going out on a hike or when I'm going on a bike ride. When I can reapply, it's coming with me so that I can reapply it. But I like this one a lot. And they have this at Costco and all those kinds of places. So, one of the main points I want to emphasize with you is that early detection can save lives, truly save lives here when we're talking about melanoma too. So it's an over 95% cure rate when melanoma is found early. Regular exams, we can find these early or even before their melanoma too. And skin checks, I'd like to emphasize as well, are pretty quick and pretty painless. So I think it's important to have one at some point by someone. When should you definitely see a dermatologist? So if you have a new changing or bleeding mole, that's something that should be looked at for sure. A persistently non-healing spot, like we talked about earlier for basal cell and squamous cell skin cancers. You should have an annual skin exam if you're high risk. You'll only know you're high risk after you've seen a dermatologist and they can kind of talk to you about that. Not everyone needs a full skin check every year though. So you're not stuck going there every year if you go in for one check, don't worry. And then monthly self-checks for everyone, get naked, when you're getting in the shower, look around, if there's like a new spot, have it checked out by probably your spouse first. And then they're like, I don't know. And then have a doctor look at it. So common myths that I'd like to bust for you. Many people think that it's safer to get a base tan before they go on vacation. No, this isn't good. Whenever you're getting color to your skin, whenever you're getting a tan, that's sun damage. That's your body trying to put up a fence between you and radiation from the sun. So pale skin is healthy skin, always. Sorry. You can, oh, this is beeping at me, I don't know why, but you can burn on cloudy days. This is actually the more common type of day that people get burned on because they're not feeling the intense heat from the sun. So they're not reminded to use sunscreen for that reason. So you absolutely can get burnt on cloudy days, and you really do. I've gotten some burns on cloudy days myself. The vitamin D question is a good one. People think that they have to get vitamin D from the sun, but you don't. You can totally get it from diet or supplements if you have to. It really only takes 10-15 minutes to get your daily dose of vitamin D. Unprotected skin exposed to the sun to get it. Most people shouldn't even be getting that amount, especially in the day of sun, but vitamin D deficiency matters to me. I do think that it's important to get vitamin D, but I don't think it's safe to get it from the sun and lean on that. I think that that statistic on that would be most of your body exposed for 10-15 minutes. Yeah, you should be getting some. Yeah. I try to be reasonable, but it's better to get it from diet and supplement. Everybody should have their vitamin D checked too, by the way. And then I don't need sunscreen because there's SPF in my cosmetics or creams. I know we talked about that, sorry. So looking ahead to leaning into AI, like everyone else is trying to do, they are having assisted mole mapping kind of technology that's up and coming. That's pretty neat. that can help us, you know, really hone in on moles that are changing with full body photography. But for now, we have to kind of use our own photography skills. And this can include taking pictures of spots yourself that you're worried about. If it's changing, it's going to show in a picture that it's changing. And I definitely lean into using photos in clinic a lot because our memory deceives us. So your action plan is to do a self-check. Any spots that you're worried about, keep an eye on or have someone look at it sooner than later. Wear sunscreen every day. Find one that you love to put on. Use it every day. Schedule a skin exam if you've never had one, and share what you've learned with your friends and family. Questions otherwise? Yes. Mm-hmm. So until you're 30 or so, early 30s, you're still going to be getting new moles. So those are going to be changing because they're still kind of marking out territory where they are. So young people, for that reason, I don't get too excited about, you know, minimal changes or kind of growth when they look benign. But at, you know, at the point after early 30s, a mole really shouldn't be changing if it's a mole. Lots of spots that come into me, they're like, but this is changing. You said if it's changing, it's worrisome. I'm like, well, it's not a mole. There's lots of other skin lesions. This isn't a germ lecture, but there's lots of other skin lesions that you can have that can change. That's okay if it changes. But if it's a mole, generally like a brown spot, it shouldn't. Anybody else? Yeah. It depends on the, yeah, it depends on the product. Probably I use like a quarter sized amount, what I use on my face, and then I kind of spread it down my neck and ears. Um, yeah, you kind of know when you're being skimpy. You're probably suspicious of that yourself, but it also shouldn't be like sitting on top of your skin and making you miserable either. I want you to be really happy with your sunscreen. That's an important thing. So there's a happy medium. Mhm. So usually most tint or lack thereof in cars don't protect you from UVA rays, maybe some UVB protection and some tint, but having your windows tinted if you're at increased risk of skin cancer is something I write letters for often. Yeah. I see a ton of bad skin cancers and truck drivers on like their left arm and left face, and ladies historically are passenger princesses, so they're on the right side. Any other questions? Great. Well, I'm here for a little bit longer. I have to get back to clinic in a little bit, but if you have any other burning questions, let me know. This has been really fun. I'm glad we had some engaging conversation and questions. And I'd be happy to point you in the direction of our clinic or someone else's if, you know, insurance is an issue, but we do see all insurances at our clinic. I'm lucky to have that. So I'd be happy to see any of you or point you to a colleague of mine. Okay, thank you.